Alright, so where I left off is a nurse telling me about the PCOS. In that year after being told, I had to find a way to get health insurance. A lot of companies where I was from weren't offering health insurance. So I ended up getting health insurance on my own through a broker. And I ended up making an appointment to see an endocrinologist. And him and I actually became pretty good friends. It was so much to take in that first appointment, between finding out all the real side effects of the PCOS, everything that I had been struggling with since I was 13, all these things along the way that I wish me or my parents or somebody could have caught on to. But you put a lot of trust into your doctors and hope that they know for the most part what they're talking about. This syndrome wasn't something that was talked about a whole lot, and as a teenager, the doctors were looking at the side effects I was going through and not the whole picture. Sorry, I had choked on some water before I started recording this. So my life flashed before my eyes. Excuse me. So at 22, like I said, I finally made an appointment with the endocrinologist, and he scheduled to have all kinds of blood work done. They checked for my, and I always say this wrong, pituitary gland? I think that's how you say it. They checked that. They checked for the PCOS, which is a lot of blood work. Picking my brain, trying to remember now. I think they test your testosterone level. Trying to remember everything else. There's quite a bit of stuff that they test you for. It isn't just one simple blood work, oh, you have PCOS. No, they're looking at a bunch of different things between ultrasounds, what you say to them, and this blood work. What else did they test for? They did some blood work to check my liver enzymes, and I was also tested for diabetes. So of course the blood work came back saying I have PCOS, but one of the scary things is my liver enzymes were off the charts. I definitely had a liver problem going on that nobody knew about. That was really scary. I was, 21, 22 years old. I didn't go out drinking all the time. I would have a drink once in a while. So I knew it wasn't drinking that caused the problem, because I really don't drink a lot. I ended up having to have a liver biopsy done, which is awful. That is probably one of the worst things I've been through. You're awake for that. And what they do is you go into a room, and there was somebody there who was working with the ultrasound machine. There was a nurse there, and then there was the doctor. At first, it was just the nurse and the lady with the ultrasound machine. The nurse was setting me up with everything. I made the mistake of looking to the counter, and I saw the needle that was like this long that was going to be going into my side, which terrified me. I wish I didn't look around. So the lady with the ultrasound decided which way that they were going to go in, put a little purple marker on my side. It was in between two ribs. And then the doctor came in, and he told me, when they tell me hold my breath, I have to hold it. And if I move or if I breathe while the needle's in me, they can puncture a lung or hit an artery, which is terrifying. So they have you sit down. I had my arm up over my head as they went into my rib cage. They went in 5 times and got 4 samples. The thing that scared me the most is they don't tell you that this can happen, but they do something and it causes a nerve reaction where I felt the need that I had to drop my arm down while he was in me. The nurse caught my arm. I can't say it hurt, because it didn't hurt. I can't describe how it felt. So that was all done. Then you have to go into a recovery room for about 3 hours, and they want you just to lay there so it can clot. It isn't a horribly dangerous procedure, but it can have its complications like everything else. My blood pressure had gotten really high because I was in so much pain afterwards. So I think I had gotten like 2 or 3 Percocets while I was there, and then my blood pressure dropped really low. Um, so they got concerned about that. So, it was just being kept an eye on. They were talking about keeping me possibly overnight. But I decided that I wanted to scare the doctors by throwing up, which is a sign of internal bleeding. Um, it was right after I was allowed to sit up and I could eat something. I was trying to snack on, I don't even remember what now. But I'd gotten up, ended up throwing up. My husband went running to go get a nurse, and they rushed me down into a CAT scan to check to see if there was internal bleeding. Thankfully, there was not, and I was allowed to go home. For about a month, it felt like somebody had punched me in the side. It was very sore. Um, yeah, it was about a month of feeling like that. And I got the results back from that, and I had stage 3 liver disease. It was fibrosis without cirrhosis, which is scary. I mean, they told me if it continued going like this and I didn't get a liver transplant, I probably was looking at about 5 years to live. Well, I'm looking at you telling you I never got a liver transplant, and it's been about 8 years, right? 22, 6 years. I had to have been younger than that then. I had to have been 7 years ago. I must have been 21. Um, so I beat the odds with that. I mean, they can't give you prescriptions for that or anything. I did some diet changes, and I had to see a doctor at first every month for blood work, and then it went to every 3 months, and then every 6 months, and it's actually been, I'm probably due for blood work at this point. It's probably been, it's awful, it's going to sound about a year. Um, but I feel okay. Um, I have gained a lot of weight since being diagnosed, probably about 40 pounds, but I've also now lost 25 pounds. I'm going to be honest, and I got up to almost 300 pounds. Even though I was told that I never looked like I weighed that much, I have height on my side, thankfully, but that's a lot of weight to be carrying around. I think I was up to, I think I got up to 280, and that was my heaviest. I'm not going to say how much I weigh right now, but it's not even close to that at this point. Let's see, what else ended up happening? After I found out that I had the PCOS, they put me on the birth control pills. It was another pill, and I cannot remember the name of it for the life of me. I want to say it began with a C. Is it called Clomid? I think that's what it was, Clomid. No, I think that's infertility medicine. There's so much medicine when you have PCOS, so I'm sure that you guys understand. Maybe somebody can list below what this medicine is I'm talking about, because I cannot remember it for the life of me. Spironolactone. That's it. Spironolactone. That's what it was. And what else did I get put on? I had to watch what I ate very carefully. No drinking. I haven't drank any alcohol since I've been diagnosed with that. Which again isn't a big deal to me. I don't even care about drinking. So after that, the spironolactone really helped out with my acne. That was amazing. My acne cleared up within probably a couple of months. I had really greasy hair too, and I know that's probably a part of the PCOS, and that stopped as well. I actually had to start doing deep conditioning because my hair had gotten so dry. But just what made me the happiest, honestly, at that point was my acne going away. I had been struggling with acne for so long, and to have it go away was amazing. It helped a little bit with the hair growth that I had, but not completely. So after I think it was a couple of years of doing that, I went and talked to my endocrinologist again, and we had decided to do ovarian drilling. Not for the fertility part of it, but to help with everything else. And basically what ovarian drilling is they go in with a cauterized needle, and they poke each of your ovaries a certain number of times. I had each one poked about 10 times, and it did help. It helped with some of the hair growth, but it's just a temporary thing. Not something I would suggest people doing unless they were trying to get pregnant at the same time. because it can cause issues down the road. You can have scarring. It can cause a lot of problems. So I wouldn't suggest it unless you absolutely have to have it done, or if you're trying to get pregnant at the same time. So that was it with my struggle with that. After all this, I contacted newspapers. I wanted people to be more aware of the PCOS. I don't want doctors thinking that their patients are hypochondriacs when they're coming to them with all these things, because some of the symptoms are high blood pressure, weight gain, male pattern hair growth and hair loss, acne, irregular periods, no periods, obviously ovarian cysts. I'm trying to think of everything that I have had. You know, really oily skin, that's a part of it. I think I already said the weight gain. You know, you can have insulin resistance. It's important to get tested for insulin resistance and diabetes if you have PCOS. Yeah, I think that's most of the signs. Of course, there's always some off things that some of us have that others don't have. But yeah, in my next video, I'm going to talk about our infertility struggles, what we've done so far, what we're doing now, and after that, I will probably go on to probably stuff that I do to help take care of my skin, to help with the acne. I think age is helping me a little bit now. 28 years old, so my body's settling out a little bit. I'll show you some of the facial stuff that I do. I'll show you the makeup that I use. And then after that, I think maybe we'll move on to diet, what I do for diets. I already have a little thing in front of me that I just made to help explain things. And yeah, so hopefully you guys are enjoying these videos. Again, if you have any questions about anything that I've been through, please feel free to ask. I'm not going to be bashful with sharing the information for you guys. I really want to be there to help you. I've gotten to the point where I don't cry about it anymore. I think if I probably would have done a video like this even 6 months ago, I probably would have been crying. But I'm in a good place now. Everything happens for a reason, and I think that my reason is to try to help and educate other people about the PCOS, as I've done in the past. So hopefully, you know, I helped out people locally in New Hampshire, and hopefully we can do a world connection with women all over the world who have the syndrome and share tips and tricks. So yeah, that's that, and hopefully I'll have a video up in a little bit. I have a ton of energy right now, and I want to take advantage of it and upload as many videos as I can today. So that's that, and I hope you all are having a great day. I hope these videos help you out, and I will talk to you later. Bye.